Okay, thank you so much for waiting. So let's begin. Assalamualaikum warahmatullahi wabarakatuh. My name is Annisa Maharani. I'm here with two of my friends. They are Defi Sulistyoningsih and Mayda Shaila Putri. And today we are going to present about maple syrup urine disease. Next. So we're going to talk maple urine disease that divided into 7 chapters. First, we're going to talk about the definitions, signs and symptoms, cause factors of MSUD, degradation of BCAAS, classification, nutrition management, and treatments. So the first presenter is Defi. Time is yours.
Okay, thank you. Am I audible?
Yes.
Okay. Okay, I'll start from the definitions of maple syrup urine diseases. So basically, it is a rare genetic disorder that caused by the mutations of 3 specific genes. It's usually happen in a newborn baby who inherited their mutation gene from their parents. And the majority of children that are diagnosed by this maple syrup urine diseases is in the age between 5 months until 7 years. It is characterized by the deficiency of branch chain alfa-keto acid dehydrogenase, in which that's a complex enzyme that has the functions to break down the 3 branch amino acids, leucine, isoleucine, and valine. And the result of this metabolic failure is that all the 3 BCAAs and their toxic byproducts will accumulate abnormally within the body. And we can see here in the picture besides, we can compare the color of the sufferers of maple syrup urine diseases having darker color of urine, just like maple syrup, if we compare to normal color urine. And if it keeps untreated, symptoms will begin to emerge, and often within the first 24 until 48 hours of life of the newborn baby. Okay, the next signs and the symptoms of maple syrup urine diseases. The first symptoms that will appear in the baby is they will have a poor feeding at the bottle or breast and will increasing the lethargy and irritability. And the further symptoms that will appear is that they will start to show increasing focal neurological signs, including abnormal movements, and increasing hypertonia, which is the conditions there is too much in the body, for example, in the legs or in the arms, and it will cause the difficulty of moving. So the next symptoms is seizures and coma. In the end, the central neurological function will fail with respiratory failure and causing death. Individuals with MSUD may show a degree of intellectual limitations and may develop several mental issues such as attention, hyperactivity disorder, impulsivity, anxiety, and just like from their name, general symptoms from these diseases is their body odor will smells like a maple syrup. Yeah, just like a maple syrup.
Okay, next, from what Defi said, we have to know first about branch chain amino acids that we call BCAAs. The branch chain amino acids are a group of 3 essential amino acids. They are leucine, isoleucine, and valine. BCAA supplements are commonly taken in order to boost muscle growth and enhance exercise performance. They may also help with weight loss and reduce fatigue after exercise. And this is the structure of lysine, isoleucine, and valine. And we know that lysine is a dietary amino acid with the capacity to directly stimulate myofibrillar muscle protein synthesis, and this effect of lysine arise result from its role as an activator of the mechanistic target rapamycin or mTOR. And isoleucine, as one of the branched chain amino acid, is also critical in physiological function of the whole body, such as growth, immunity, protein metabolism, fatty acid metabolism, and also in glucose transportation. Valine is one of 3 branch chain amino acid, that meaning it has a chain branching off to one side of its molecular structure. So the 3 of these are very, very important in our body. Next.
So maybe you are wondering, so what cause of this disease happened in the first place? Maple syrup urine disease is a rare genetic disorder caused by mutation in one of 3 different genes, that is BCKDHA, BCKDHB, and DBT. These 3 are protein coding gene, and BCKDHA itself is short from branch chain keto acid dehydrogenase E1 subunit alpha, and BCKDHB is subunit beta, and DBT is dihydrolipoamide branch chain transacylase E2. Mutation in these genes result in absent or decreased activity of human brain chain alpha-keto acid dehydrogenase complex enzymes, or we can simply wrap it up as deficiency of brain chain alpha-keto acid dehydrogenase enzyme complex, who is responsible to break down BCAAs. As mentioned earlier, the BCAAs are leucine, isoleucine, and valine. The mutation is initiated by autosomal recessive inheritance, whereas 2 copies of non-working gene from each parent develop the condition. If an individual receives 1 working gene and 1 non-working gene for the disease, the person will be a carrier for the disease, but usually will not show symptoms. Next. Okay, let us take a look at the picture here. Okay, this picture shows how BCAAs normally break down. Notice that there are 2 main reactions involving 3 different compounds, amino acids, alpha-keto acids, and acetyl-CoA derivate. Reaction 1 is transamination, which amino group is eliminated from the amino acid by branched chain aminotransferase, resulting alpha-keto acids form. In the other hand, reaction 2 is irreversible. The carboxylation of branched chain keto acids by branched chain alpha-keto acid dehydrogenase enzyme complex, resulting acetyl-CoA or succinyl-CoA. So now what happened to this breakdown process if you develop maple syrup urine disease condition? Here's what happened. Look at the orange arrow next to the number 2 at the picture. Your condition will block the second reaction from happening, or the reaction 2 in your body is impaired because of deficiency of BCKD enzyme. Therefore, alpha-keto acids form, 1 convert acetyl-CoA or succinyl-CoA, and eventually accumulate in your tissues and plasma, which is neurotoxic. Remember that the first reactions is reversible, so amino acids form and alpha-keto acids form will be found. Next. Maple syrup urine disease are classified into several types. The symptoms and severity of MSUD varies greatly from patient to patient and largely depends upon the amount of residual enzyme activity. So the first one is the classic one. It is typically have enzyme activity less than 2%. They present with poor feeding, lethargy, irritability, maple syrup-like or burnt sugar smell, and ketonuria in first week of life. And without treatment, they develop progressive neurological deterioration due to cerebral edema, culminating in coma, and central respiratory failure, and also death. The second one is intermediate classification. The residual enzyme activity varies from 2% to 30%, and symptoms are similar to those of the classical form, both the first and continuous symptoms. Mild form, where intermittent form is a mild form where patients are asymptomatic with normal levels of BCAAS, but with catabolic stress are at risk of acute decompensation with ketoacidosis. Next.
Next, this is the metabolic pathway in the metabolism of branched chain amino acid isoleucine, leucine, and valine. That the maple syrup urine disease is an inborn error of branched chain keto acid dehydrogenase, or BCADH enzyme complex required for the catabolism of branched chain amino acid, such as leucine, valine, and isoleucine. And from this metabolic pathway, this is leucine, and it's very well corresponding keto acid to 2-oxoisocoproic acid are the primary toxic compounds in this disorder. So principle of nutrition management for MSUD is restrict that branch chain amino acid, especially leucine, and the supplement is valine and isoleucine if plasma concentrations are below from the target range, and the toxic metabolite leucine and its keto acid 2-oxoisocoproic acid. Next. Okay, patients will present these symptoms in the newborn period, and we have medically stabilized, as well as those who are asymptomatic at diagnosis require. So, require leucine restrict diet, as this table is provide suggests goals for nutrients intakes for infants with MSUD. Next. Okay. The steps for initiating a diet in an infant are outlined in step 1 till step 7. Goal for reduce or normalize plasma leucine. With the first step is establish intake goals. The second step is determine amount of standard infant formula, also protein and energy. The third step is subtract the protein, and then calculate amount of BCAA free medical food, and then calculate valine and isovaline intake, and determine the number of calories and the amount of fluid required. This is based on Van Kalker 2015. Okay, next, this is also important in MSUD that only the leucine content of food and beverage need to be counted. There is no need for caregivers to calculate the valine and isovaline content of food unless there is a concern about how energy intake. So this is how to counting leucine intake in the MSUD diet. Only dietary leucine must be counted. That the valine and isoleucine content of food is about half of the leucine content. And patients will not get too much valine and isoleucine if they consume the prescribed amount of leucine. Each gram of protein contains approximately 60 milligram leucine, and a food list of leucine content is available. Next. Symptomatic MSUD in neonate is a medical emergency and requires the immediate initiation of nutrition support to reverse catabolism, and non-protein calories are provided by peripheral or central line access. And this is the acute nutrition management in the sick day diet for patient with MSUD. The first one is the 6-day diet must provide enough energy, and then increase the protein, decrease lysine perception, prevent low blood concentration of isoleucine and valine, provide small frequent feeding throughout a 24 hours period, and the last one is monitor plasma concentration of BCAA. And the treatment is there's two main approaches. There are long-term daily dietary management and treatment of episode of acute metabolic decomposition. The treatment in a hospital, we can get the doctor will give us glucose and insulin through a vein using an to adjust the level of amino acid in the body, and use an or nasogastric feeding tube to deliver particular nutrients, including the type of amino acids the person can tolerate, and then filter the person's blood plasma and to return it to their body. And the last one is monitor the patients for signs of brain swelling, of infection, and acid buildup. So this is our references. That's all from our presentations. Thank you.